Heart treatments have progressed exponentially in the world. In the past, some heart treatments could be done in the operating room. Some heart treatments could be done in a Cath Lab where angio-based procedures are done largely. Now, increasingly, complex treatments require Cath Lab and an operating room to be in the same environment to deliver the best outcomes for complex treatments for patients. And that's why we need a hybrid operating room. So a hybrid operating room, or what's abbreviated as a hybrid OR, is a one-stop shop where anything and everything, especially the most advanced cutting-edge cardiovascular care, can be delivered safely to get the best outcomes, and that's the worldwide standard. In the recent years, nowadays we can change valves, heart valves without surgery, which previously required open heart surgery. This is a procedure called TAVR or TAVI, which is abbreviated for transcatheter aortic valve implantation or replacement. Across the world, the American guidelines and the European guidelines state that the safest and the most sophisticated environment to deliver such complex treatments is a hybrid operating room. So we are very fortunate here at Kauvery Hospital in Tamil Nadu to have the country's first sophisticated flex-arm hybrid operating room, and this is largely down to increased safety and efficacy of procedures for patients where their quality of life is enhanced in the safest environment with the least invasive option. The Philips flex-arm hybrid operating room, which we have here at Kauvery Hospital, is a very sophisticated hybrid operating room. It is the latest and state-of-the-art hybrid operating room, and it provides a one-stop solution for all cardiovascular treatments, all neurovascular treatments, all trauma treatments, and any orthopedic procedures or spinal procedures. One of the biggest advantages of a hybrid OR as good as this is that it allows multiple specialists and multiple equipment to be used at the same time on the patient to be able to quickly give the best care, and the patient doesn't have to move between various theatres. Now, it allows us to take up really sick patients in a hybrid operating room because anything and everything can be delivered exactly in the same sitting, thereby bringing the best outcomes for the patients. Therefore, it has really pushed boundaries for us in our capabilities to be able to treat any patient that walks through the door. One of the very deadly diseases is aortic disease. This is the main blood vessel that leads from the heart and supplies blood vessel to the entire body. It's called aorta, and this can lead to various life-threatening problems in some patients. One of the biggest risks with patients with aortic diseases are that they could develop a tear, which is referred to as a dissection, or they could rupture because of abnormal dilatation. The best environment to treat these patients is a 24/7 aortic center, and that aortic center requires a combination of endovascular treatments, which is treatments without open surgery, and some treatments with open surgery, and that is what offers the best outcomes across the world. The best environment to deliver all this in the same place is a hybrid operating room. I'm very delighted to be part of the Kauvery Hospital family, and to me, what excites me is cutting-edge cardiovascular care, and that's what I strive to achieve. Adding to that, having sophisticated equipment like the hybrid operating room to be able to push boundaries, to treat more patients, to be able to focus on safety and outcomes makes it very appealing for clinicians like myself, because that's what drives us every day.